Hello doctors, welcome back to Jab Studies Made Fun, and for today our topic is going to be dengue. Now recently I also suffered from dengue and I thought let's start again. For it's been 2 to 3 weeks since I stopped posting because of the weakness and stuff. So I was like, let's talk about dengue because dengue is now in such a rise in India that many people, including doctors, even normal people, don't know how to treat it and they don't know what types are there. So let's discuss this all in a nutshell in a quick video, and you will be able to manage, treat, and understand what is dengue. So let's start. First of all, know what is dengue. Dengue is a viral infection, and the virus is going to be your dengue virus. What type of virus it is? RNA or DNA? It is an RNA virus. And next they will ask you what is the genus. The genus of the dengue is going to be flavivirus. Flavivirus. Okay. Next is the transmission. Now there are multiple mosquitoes like Culex and Aedes. And remember this, that the dengue virus is spread by the mosquito which is your Aedes aegypti. How do you differentiate it by other mosquitoes? First of all, it's going to be large and you see a tiger type pattern. So remember, it is also known as a tiger mosquito. So this will be an identifying feature that you'll have the stripes, white, black stripes. So remember, dengue is spread by Aedes aegypti. Next, they'll ask you stereotypes. Usually you have 4 stereotypes which will be there in dengue. And for example, if like last year also I had dengue, so then that was a different stereotype which I was infected with, and this time I might be infected by another stereotype. Usually you do get resistance with one stereotype, but that does not mean that you will get resistant to the other stereotypes as well. If you talk about diagnosis, there are 3 ways you can diagnose dengue. First is the best one, which is serological. Serological test is an ELISA test to detect the antibodies. Ideally, in an inactive infection, as you all know, it is going to be IgM. But there is an issue with this. As you all know, your body takes time to fight an infection. So for example, if you have the dengue virus, it takes at least 4 days, minimum 4 days for this antibody to build. So for example, if you have on the first day of symptom, maybe you have fever and you're suspecting dengue, and then directly you go and test for the serology, it won't work. It takes a minimum of 4 days. 4 days minimum will be required, and after which you can get a serology positive test. Next test to detect the viral RNA is going to be the nucleic acid aggregation test, that is the NAT. And the one, if you ask you if I want to diagnose dengue by the first day of symptom, that is going to be your NS1 antigen, non-structural protein antigen. Let's talk about NS1 antigen in detail. If you talk about the NS1 antigen, it is going to detect the non-structural protein 1. And when can it detect? From the first day of onset of symptom, it can detect. Remember, you can detect the NS1 antigen from the first day up to the next 7 days. Why do you think why only 7 days is? Because as you know that within like 4 or 5 days the antibodies are building. So now what our body is trying to do is it's trying to clear the infection, and this NS1 antigen is on the surface of the dengue virus. So as they try to clear the dengue virus, NS1 antigen is also clearing. So maybe even though the dengue is still there in the body, but because of the clearance of by the body, the NS1 can be negative. So you will have a false negativity. So make sure whenever you do NS1 antigen, it is going to be from day 1. Day 1 of what? Day 1 of onset of symptom, the fever, the joint pains, that time. So day 1 up to day 7. So during these days, especially, you can detect using the NS1 antigen. While if you remember, just now we talked about ELISA, which is going to be serology for IgM, can start from up to day 4, and after that it can be like after even 8 days, 9 days, you can also do this test because the antibodies are already built. If you see, as I told you, if you might go for an NS1 antigen and then you might get a negative test. That does not rule out dengue, because as I told you, after 7 days, the efficacy, the sensitivity of NS1 antigen is reduced. So after that, even though if after maybe, after onset of symptoms, it's the 8th day, 9th day, you do the NS1, it's negative. For confirmation, always do a serology. That is going to be your IgM serology. If I talk to you the types of dengue, basically you need to know there are 4 types. Dengue without warning sign, in which most of the patients, they suffer through this and they recover also after this period as well. Then you have dengue with warning signs. Severe dengue, which was also known as dengue hemorrhagic fever. And then you have dengue shock syndrome. Let's talk about them and the treatment one by one. First of all, we'll talk about dengue without warning signs. You can see something which is there, which is incubation period. What is incubation period? Incubation period is from the onset of bite, the mosquito Aedes aegypti bit me. From that time up till the beginning of symptom, which means the period where nothing was there. when the period was nothing was there, onset of bite till when I started the first day when I developed fever, that is your incubation period. So the incubation period up to which where there is nothing happening in dengue is 4 to 10 days. Is 4 to 10 days. You need to know that, very important. So along with this, remember what are the symptoms you get in case of dengue without warning signs. First thing is you get high grade fever up to 40 degrees Celsius. Along with 40 degrees Celsius of high grade fever, any two of the following, which is you will have severe headache, retroorbital pain, myalgia, arthralgia, severe pain, lower back pain. That is why this is also known as break bone fever. You might even have a rash, especially in the trunk side. There is macupapular rash, which sometimes look like the rash which you see in measles in a child. Along with this, you will also have generalized lymphadenopathy. Now, it's not necessary you might have everything. People have nausea, people have vomiting also along with this. But main thing what I told you is you're going to have high grade fever. Along with that, any two of these following: retroorbital pain, headache, lymphadenopathy, vomiting, or a macupapular rash. Let's see what rash we are talking about. Over here, you can see this is a macupapular rash, mostly seen in the trunk side. Along with this, if you see, this rash is like this. If you see the pale white, this is known as a blanching rash. Blanching rash, which means when I'll apply some pressure over there, you will see because of it's the ECF, it goes outside. That is why you will see the dengue rash is actually a blanching rash. Okay, so you remember macupapular rash and then you'll have a blanching rash. Now, at the time of recovery, some patients can develop this type of rash. You can see white rash around a skin which is red in color. So this is known as white island in Red Sea pattern. Okay, white island in Red Sea pattern, and this is the rash which is seen in the recovery phase of dengue. Okay, so make sure you know the differentiation amongst all of this, which is one is going to be your macupapular rash. Then what type of rash is this? It is going to be a blanching rash. Just a second, I'll just turn off the alarms. Okay, so it is going to be a blanching rash. Along with that, if you see at the time of recovery, you're going to have this white island in the Red Sea type of pattern at the time of recovery. Let's talk about a further test which you can do, which is a positive capillary fragility test. What you're going to do is, like usually whenever how you check the blood pressure using a sphygmomanometer, you're going to check the pressure. Now, for example, if you check a normal blood pressure of a random guy, you found out it is 120 or 80. Now, this 120 or 80, 120 is systolic, 80 is diastolic. Take the middle part of 120, 80. That is going to be 100. So what you're going to do is, you're going to apply the pressure, you're going to keep the sphygmometer on hold for 100 for up to 5 minutes. After 5 minutes, what you're going to see is, you're going to see like this particle rash which will be developed. In an area of 1 centimeter and 1 centimeter, if you find more than 10 such particle rash, over here you can see there are more than 10, it's around 20 also. So this can be a sign of positive capillary fragility test. Now, why this is happening is, first of all, you need to know in dengue that there is thrombocytopenia. The dengue virus attacks the platelets, due to which you will have bleeding because the platelets are not able to adhere. So, and there will be capillary leak. That is why this shows a positive sign for dengue virus. How you are going to do it? As I told you, take a midpoint of the diastolic and the systolic pressure for 5 minutes. If you get more than 10 particles in that area of 1 centimeter, 1 square inch, then that is going to be a positive capillary fragility test. Now, what are the treatments? Now, this time I'm going to talk about treatment in dengue without warning sign. First of all, for fever, only you have to give paracetamol. You should not give any other NSAIDs like aspirin, ibuprofen, because they are thromboxane A2 inhibitors. This can further cause increased risk of bleeding. People who already know paracetamol, the mode of action is a COX-3 inhibitor. The mechanism is also different, so that is why the chance of bleeding with paracetamol is low. Okay. If they'll ask you another thing, how high grade fever can be reduced, even in my case it helped a lot, that was cold sponging. Cold sponging will help a lot. Now, if you ask me is there any drug for dengue, there is no such drug for dengue. The only thing in dengue what you have to see is hydration. Many people think that you need IV fluids for dengue, and that is completely not true. What you need is proper hydration. And if a patient is able to have proper oral feeds, continue with that. I'll explain you why later on. The main reason is third space fluid loss because of fluid overload if you're giving too much IV fluids. We don't want that. So that is why you're going to ask the patient to drink as much as water. Ideally preferred is going to be ORS, because you can, all the electrolytes which are lost, it can be replenished by this. So remember, ask them to have ORS, and for fever you have to have 6-hourly paracetamol, and it's very high grade fever, give cold sponging. Next, let's talk about dengue with warning signs. Now comes the tricky part over here. Now in dengue with warning signs, you have something which is known as critical period. What is critical period? Critical period is that period where you will start developing these warning signs. And when does this happen? Critical period is usually seen when the fever is going to subside. Now as a patient, if I see that the fever is subsiding, means I am recovering. So I'll stop ignoring any signs and symptoms and all. That is the worst part of dengue. Whenever the fever subsides, that time you have to see that this is the time we have to be cautious. Patient is going to get, they are going to they'll go from the hospital to the home. That time you have to ask them to watch for these severe warning signs, because this can show that the disease is getting more messed up. Remember, what is critical period? It is a period at which you get to see the warning signs. When is this? Whenever the fever subsides, or 3 to 7 days after the symptom onsets. High grade fever, myalgia, arthralgia, like that. Okay. Who are the people at risk? The people at risk are, first of all, severely immunocompromised people, whoever have severe comorbidities, severe uncontrolled diabetes, uncontrolled hypertension, infants who are less than 1 year, and also who had a previous history of dengue infection. So I was one of them. Thank God I did not get it. Okay. So if I'll ask you, what are the warning signs? Severe abdominal pain. You cannot even drink water. That much severe abdominal pain will be there. Persistent vomiting. No matter how much MSET or ondansetron you're giving, still the patient cannot stop vomiting. Enlarged liver, hepatomegaly. When you will start palpating over here, you will find out that there is hepatomegaly up to more than 2 centimeters. Now in dengue, what happens is that the capillaries get weak. There will be capillary leakage, because of which you will see there is third space fluid loss. This third space fluid loss comes in appearance as pleural effusion. So they'll have difficulty in breathing, and along with that they will have ascites as well. So pleural effusion can be seen, and ascites also can be seen. Now because your fluids are getting lost into the third spaces, your blood, the RBC is present within the blood vessels, because of which the hematocrit is going to increase. The reason why hematocrit levels are going to increase over here in dengue with warning signs is because there is third space fluid loss. So all the RBC, the concentration is going to increase. That is why you will see that there is increased hematocrit levels. Because of TCP, thrombocytopenia, you're going to have gingival bleed, you're going to have petechiae, and you'll have nosebleed as well, which is known as epistaxis. How do you manage dengue with warning signs? Now this is not a treatment of at home. You have to ask them to come to the hospital. You have to admit them. First thing what you have to do is you have to check the hematocrit. Okay. Along with this, you have to see whether the oral intake, the fluid input and output is adequate or not. If you find out that the patient is dehydrated, the patient's fluid intake is not good, now you have to start with them with IV fluids. That is going to be isotonic crystalloids. Remember, you have to give isotonic crystalloids. You should not give hypotonic like 0.45 saline. If you give a hypotonic solution, there will be further more third space fluid loss. There will be further ascites and pleural effusion. What you have to give? You have to give isotonic fluids like normal saline. If potassium is less, give Ringer lactate. And how you have to give this? You have to give this in a stepwise manner. If you notice the stepwise manner, first I am giving 5 to 7 ml per kilogram per hour for the first 2 hours. Then I am tapering the dose to 3 to 5 ml per kilogram per hour in 2 to 4 hours. Now the reason why I am doing this is because IV fluids are not a seldom necessity in case of dengue. Because if the patient's fluid intake is good and I am further putting more IV fluids, there will be fluid overload, causing again fluid to go out to the third spaces and again worsening the ascites and pleural effusion. If I see with the IV fluids, even the step down pattern, if the patient is not improving, then I will increase the IV fluids. If my patient is already good, he's able to drink orally, then I'm going to change from IV fluids to oral fluids. How I'm going to check the urine output? Because the patient is admitted with us, we're going to put a catheter, and with the catheter I can assess how much is the urine output, how much the patient is consuming, and how much it is coming out. Okay, fever control again, paracetamol and cold sponging. What else should I see? Hematocrit. Why am I saying the hematocrit? Hematocrit, if it is high, it gives me a sign of yes, there is third space fluid loss. If hematocrit is low, which means there is internal bleeding. Fluid intake, volume output, that is going to be done by how? By your Follies, which you'll check, and you'll see in the urine bag, you can see the level as well. And monitor the vitals every 4 hours. This is the management of dengue with warning signs. Next, we'll talk about severe dengue. What is severe dengue or dengue hemorrhagic fever? A very dangerous condition. What happens is, if one person is already infected by a serotype, one type of dengue, and at the same time he gets bit by another Aedes aegypti who's carrying a different serotype. So you see, there was one serotype already, and he now got bit and got infected by another serotype. So this is like double dhamaka. It is more dangerous and much more severe because now the body has to fight against two serotypes. Already one was very dangerous, and then you are having another one to fight now with you. That is why this is known as severe dengue, an emergency condition. It is also known as dengue hemorrhagic fever because the amount of bleeding is insane. You will have severe organ involvement, hepatomegaly, liver failure. The patient will go in confusion. Patient will not understand what is going on. Again, severe third space fluid loss, respiratory distress will be there, ascites will be there, and because of the severe bleeding, when you will check, hematocrit is going to decrease. Remember what was there in dengue in warning signs? There was third space fluid loss, that's why hematocrit was increasing. In severe dengue, because of a double infection, you see now there is severe bleeding. That is why the hematocrit is decreasing. If you will ask what is the management, again it is emergency condition, you have to admit the patient. Now also I have to start with IV fluids. First you will monitor the intake and output by using the Follies, check in the urinary bag. Again, a controlled fluid, stepwise manner, in a step down manner. If the patient is not improving, then again increase the rate, 5 to 7, 3 to 5, 2 to 3. Now again, in case of your dengue with severe form of dengue, which is dengue hemorrhagic fever, again I'm going to check the hematocrit. This time what I'm going to see is, if the hematocrit is decreasing, remember you should not give platelets, because platelets, they have found in research that there is no role of giving platelets to increase the platelets. They have no, in research they have not shown any such significance. The only condition where we are saying that you should give platelets is when the value is less than 10,000, when platelet value is less than 10,000 and there is severe amount of bleeding. Apart of that, what is better is that when you give packed RBC or whole RBC. Whenever the hematocrit is severely low, that time now I'm going to give either packed RBC or whole RBC. Packed RBC is going to be given at the rate of 5 to 10 ml per kg, or whole blood is going to be given at 10 to 20 ml per kg. If my hematocrit is increasing, which means that there is third space fluid loss. Now what I'm going to give is, I'm going to give again controlled. Controlled means not to give overload. Controlled crystalloids, that is going to be either normal saline or ringer lactate. Okay, that is going to be normal saline or ringer lactate. This is going to be given at a dose of 10 to 20 ml per kg bolus over 1 hour. So you see, the management is kind of same, but the regime and the style is different. Okay. Now I'll talk about dengue shock syndrome, a very dangerous condition. Even during our postings, when I was in the fever clinic as well, there were patients who were like 30 years old, 22, 23, who were completely fine. And all of a sudden while talking, they fainted. They were not able to maintain their BP and they passed away on spot. Dengue shock syndrome. Dengue shock syndrome is when a patient is having already severe hemorrhagic dengue. Along with that, he or she is having circulatory collapse. They are not able to maintain their BP. Now, as you know that there is third space fluid loss, even normal saline you're giving, even ringer lactate you're giving, that is also going to go out. So the IV fluid of choice in case of shock syndrome preferably is going to be colloids like albumin, because colloids or albumin, they cannot go out of the capillaries, they stay within the blood vessel and they help in causing a rapid increase in blood pressure. Remember that. So what is the treatment? If a patient is now hypotensive, is not being able to maintain, you have two choices: either give an isotonic crystalloid or a colloid bolus. Preferably you are going to give a colloid bolus in 20 ml per kg in 15 minutes. If you see the patient is improving, the blood pressure is improving, you will continue the crystalloids or the colloid, but remember to slowly taper the dose to avoid fluid overload. If there is no improvement, again now we're going to check hematocrit. If the hematocrit is decreasing, which means there is internal bleeding, so same, we are going to give whole blood or you're going to give packed RBC. If it is increasing, which means there is third space loss. So over here, now directly I'm going to prefer colloids. Earlier I was having a choice between IV fluids and colloids. Right now, because you know that it is increasing in case of dengue shock, the patient can go hypotensive shock anytime. So now I'm going to prefer colloids at the rate of 10 to 20 ml per kg over next 1 to 2 hours. Okay. Remember, these are the basic treatments of the types of dengue. Let us talk about what are the do's and don'ts of dengue. What you have to do. Recognize the critical period. First of all, what was the critical period? I told you, after the onset of symptoms, 4 to 7 days, or just when the fever is about to subside. Make sure you're checking the signs. Abdominal pain, persistent vomiting, hepatomegaly will be there, confusion. These are the signs where you have to see severe abdominal pain. Make sure you monitor them, and if you see such signs, immediately go to the doctor. Do monitor fluid intake and output. Vital signs regularly, at least every 4 hours. Hematocrit levels, if it is low, sign of internal bleeding. If it is high, third space fluid loss is there. Increased risk of ascites and pleural effusion. Whenever you want to administer colloids or albumin, which is in colloids, albumin, for in case of refractive shock. What is refractive shock? The shock which is not being able to manage even despite IV fluids like ring lactate or normal saline. Do give packed RBC or whole blood for clinically significant bleeding. Again, I told you, giving platelets have no significance as with respect to research. They only found out that if you are able to give platelets less than 10,000, that would be an ideal manner. But whenever you see the hematocrit going down, the preferred agent should be packed RBC or whole blood. What are the don'ts? In case of viral infection, many times you see people giving corticosteroids. You should not give corticosteroids in case of dengue. Why? 3 reasons. Increased risk of infection, increased risk of immunosuppression, increased risk of hyperglycemia because of the cortisol, and increased risk of GI bleeding. Don't give platelet transfusion for low platelets, as we already told. They may not decrease also the risk of bleeding, and furthermore, this platelet which you're giving in a fluid manner can further cause fluid overload, again third space fluid loss, again ascites and pleural effusion. What is better? Either you give packed RBC or whole blood. Don't assume IV fluids necessary, as we already told. Why? Because again, it can also further lead to fluid overload. If you understand one thing, in dengue, the main funda is the capillaries are leaking. So there is third space fluid loss. So what you have to prefer is ORS ideally. If the patient can feed orally, give it orally. Only in very severe cases where the patient is not able to maintain the fluid intake and output, then you have to give IV fluids. Remember, I told already, don't give normal saline, which is 0.45, which is a hypotonic solution. Furthermore, it is going to go and worsen the third space fluid. Remember, this was all about dengue, which I wanted to discuss with you. It is very relevant with respect to actual clinical management, actual NEET PG FMG question as well. I hope you enjoyed this video. If you did enjoy, make sure that you share it to your friends, help them and aware them about what dengue virus actually is, and it is a serious condition. You can treat it even at home, but how you have to manage it properly. Make sure if you are like in a layman way, make sure you get your CBC done after every 1 to 2 days to see the increasing or decreasing trend. Have adequate ORS at least as much as you can. No problem if you go and washroom again and again, but that is the ideal management. I hope you enjoyed. Please subscribe to my channel. We'll make more videos such like that. I have separate subject-wise videos as well. And if I want to ask you a question, can you tell me what is the most dangerous variant of the dengue serotype? This is also a PYQ. Thank you so much. I'll see you in the next video. Bye-bye.